Well, hello, everybody. Welcome back to the Better Together podcast with Heritage Health. I'm so excited about being able to bring these conversations into the community, really open up community-wide conversations about healthcare, about all the challenges that we face as we're trying to build strong communities. Um, we're getting to the end of the year here. It's Christmas time. We're just about to slow down and pause for a second. I know that never really actually happens, but the idea is good. But we just thought for this episode today, we talk about a lot of the things that have happened this year at Heritage Health within the community. Really just, I think, is a great chance to shine a spotlight on the great work that's been happening and kind of the why behind it. When we think about healthcare inside our community, we're always struggling to figure out, how do you increase access? How do you reduce costs? How do you make things just bigger and better, make it easy? And we've been on a quest for that today. So today, I'm really excited to have Alicia Rutherford here with us on set. Alicia is our Chief Deputy Director. Alicia does an incredible job just bringing all of our projects to life. She's got a great heart for the organization, for this community, and so blessed to be able to work with you. And we have Glenn Adams. Glenn is our Chief Operations Officer. Glenn joined us coming out of Wenatchee a little while ago. Glenn's a pretty funny guy, and it's so cool to see the heart that Glenn has for helping this organization just continue to expand and improve all of the daily things that we're working on. Healthcare is really challenging, and we'll talk a little bit about that. But as we move into this for today, some of the highlights of this year, we were talking before we started recording, just some of the projects, it feels like they happened 4 years ago and it just happened this year. So 2025 has really brought in, a move into the Center for Healthy Living. We've really worked on building this, the framework for integrated care. We've opened up some rapid care, which is a really cool project that we're working on. We've strengthened our pharmacies, and we've done a lot of internal work just to make sure that this is the best place to work, best place to receive care. So we're going to spend some time talking about that. Well, let's dive in. So at the start of this year, Alicia, we were able to bring a whole bunch of people into this beautiful new space. Why don't you tell everybody about what the Center for Healthy Living is, how we got it together, kind of that planning and framework to get all of these buildings and people into this beautiful new space. It's super easy to do something like that, right?
Super easy. Yeah. So the vision behind it has always been to walk into the building and see people getting healthy together. For all of our services, doing that together as a community. So we were able to in 2024 and then ended in 2025 convert 6 behavioral health locations into one building and around 30,000 square feet. And that was just, everyone was super excited to do that. That was an easy thing. It's not easy. 6 different businesses in one building, and all of them kind of now becoming core behavioral health teams together, becoming 4 different behavioral health type services. So that was our first phase. We finished in the first part of this year, and then we're kind of working on our second phase and moving into that.
That's really exciting. It sure has made a difference having everybody in one space. So we talked a little bit about this within, the organization at the board and, within our teams. But we took separate, everybody worked for Heritage Health before, but everybody sort of had their own little flavor within the offices that they worked in. There's always a little different culture. And it's probably about 100 people.
Yeah,
Into that space. It took about 100 people that had all worked in these different spaces and brought them together into this beautiful new space. And I think it helped that it was a beautiful new space for people to move into. But it is still change.
Yeah, and the teams actually the teams that are in the space worked to help design the space. So in phase 1, phase 2 that we're moving into construction now. So the people that helped design it actually serve patients, clients in the community and help to build that space and design it with them in mind.
Yeah, it's really fun to have that buy-in.
Yeah.
When you think about sort of from the operations side, Glenn, consolidating people into a space and then planning for phase two. What are the things that you have seen or we've seen this year that have come from having everybody into this space, both from a provider standpoint and a patient standpoint?
I remember when I first started working here and this project was well underway, and the idea of bringing everyone together so that they can collaborate on the care that patients need. Instead of having behavioral health in one building and maybe psych in another building and a patient that might need both of those services, now
Mhm.
they get to walk down the hall and they get to have a conversation with both of those providers and they don't have to go anywhere. The collaboration and the relationships with our patients, with our providers has grown significantly. Super excited to add the second phase to
Yeah.
that and see how everyone works together.
Oh, it's gonna be so great. I mean, I feel just this sense of magic when I walk into that space. Um, people, this phase one. I mean, phase one was all about behavioral health, and I don't know, like I've
Huge.
I've experienced behavioral health issues in friends and family, and myself. Like it's heavy. It's a really heavy thing, and I feel like there's this sense of magic and hope when you walk in, and I really credit Alicia and the design team for making this happen. But we said at the outset that if this felt like a medical clinic, we would have failed. And you walk in, and it feels safe, it feels warm, it feels welcoming. It's really set up to make it easy for people that already have just phenomenal challenges to show up and connect with care when they need it. And one of the exciting
Yeah.
things that we've been able to do this year is open up, this same day access for therapy. And
Mhm.
that's continuing to evolve and grow. But when I look at that, I think, the Center for Healthy Living is a huge accomplishment for this community. But I look at all the work that we've done collaboratively in the community around behavioral health space to be able to now say that, look, we have access on a same day sort of walk in basis, and I mean that is a phenomenal achievement, and I want to thank everybody that's been part of this in the community. We launched this dream, probably about 7 years ago, built out the crisis center, and there's just been this continued investment in our community around the behavioral health space, and to now have us be in Center for Healthy Living, where it's real, it's happening, it's saving lives and is building community. I just think that's the huge win for this year. I'm so excited about it. Let's talk just a little bit about phase two, and then we'll
Yeah.
jump into some other exciting wins. But where are we at? What does phase two look like,
So we've
Alicia?
just so really big vision was and is and will always be to have all of our core business services together so that if you're a patient that's been in behavioral health or you have a therapy provider and you haven't seen a primary care provider, like that you could just be walk down the hall into primary care, or maybe you haven't had your teeth cleaned or you need a medication refilled. So we've spent about 6 months on the design with our architects and our partners to create a space for primary care and dental, um, pharmacy, and some of our health hub kind of community spaces for care for our community as well. So we're just wrapping up that design and starting to do some demo. I think our construction starts first week of February and goes for about 8 months
That's
before
gonna
we
be
are
it's
done.
gonna be great. I walked through there the other day, and
Yeah.
I felt lost. I've been so used to cubicle land over there, and I walked through the doors. It was like, whoa! I mean, it's just so cool to see it coming together. One of the big foundations of Center for Healthy Living, really, the dream came out of what we were doing with the Crocker X program, and let's talk about that just a little bit before we move on to the next one. But I mean, the goal of this, was really to think about primary care differently. You can come in, yes, access is there, but also our mission is to improve life. And to me, I think that means extending it and improving the quality of life. And so it's not just like come in and take a pill and yada,
Yeah.
yada, yada. But we know that life gets better when we eat better, when we exercise, when you're connected to community. And so that was sort of the foundation of what we were trying to do at Center for Healthy Living, was to incorporate that so that the providers can, go back and do visits with patients where we can really focus on building community around particular diseases. So, having diabetics together, learning how to eat better, doing foot checks, like managing their disease. I mean, we had so much success with that early on, and like having that into a space. I know you weren't around when we were doing it, but like we talked about, I think during your interview, and like you've seen what this is looking at. But from an operations standpoint, and just from the Glenn's a, Glenn's an optimist. He sees the world in a good lens. But like just as an operations person, like having that as a tool in your tool belt, like how does that make you feel?
I absolutely love the concept of the whole Center for Healthy Living with the ability to get all the services you need and have the ability to meet with a dietitian and other patients that have the same disease states, the same challenges. It really does build on that community concept that you keep talking about. The I just think it is going to be amazing to be able to get your dental needs dealt with, see your primary care doc, and behavioral health is right down the hall. And I don't think we have anything like that right now in the community. So
It's going to be amazing. I'm
Right.
so excited. Thank you both for all of your work, getting us to this point. I mean, I know Alicia spent just countless hours like making sure every box is checked in this process. And our team has been incredible that's worked with Alicia. And then, just wrangling all of the medical and dental and pharmacy providers like to go through the design process. I mean, it's been a big deal to get to where we're at today. And I just, we don't take a lot of time to celebrate these big wins. But I think, today I just like we want to take a second and say we've built something amazing for the community and we are
Yeah.
so excited about it and can't wait for the rest of the community to be a part of it. So yeah, it's been incredible. When we look back on so a couple other things we've worked on. So I think I'll say we blended integrated care into that Center for Healthy Living conversation. So let's jump over to pharmacy. So when we were talking before, it was like, oh yeah, we did start pharmacies this year. Actually did a
Feels
lot of
like it
work
was
in that.
years ago.
yeah.
Let's talk about. So what happened in the pharmacy world this year, and why does that matter for our patients?
Yeah, so up in Rathdrum, we had an opportunity to get some space right next door to our clinic, and it was already designed for us to have a pharmacy up there. And it does feel like we've always had that pharmacy, but it was just earlier this year in March that we started that project and opened a pharmacy. And for our patients, it's been amazing. They see their provider, they can get their medications filled before they leave the facility. Um, we have this amazing ability to give the best price medications for our patients, and they get to talk to their pharmacist, talk to their provider, one stop. It's pretty cool.
It's an amazing team. I mean, I think you've seen some of the impact stories that have come across, but what's your take on the pharmacy stuff as we worked on it?
Well, I think that it's just getting care and access and things right where the patient's at instead of having to go, drive to another location. And it's has a real impact on like maybe getting the prescription and just never filling it. And that happens so much.
Mhm.
Someone gets the prescription and they just don't have the time, or they go to get in line somewhere and they just don't even like, we can even have it ready for them before they leave. So I think ultimately it's just getting care where it's delivering care where it's needed and not, and removing the barriers and making it easy.
Yeah, well, Monica and the pharmacy team, and they do such a great job. I mean, Monica's whole focus with the team. Monica's our pharmacist that runs the program, and um, it's all about the experience for people. She's like, we will never be one of those pharmacies, right? You are going to walk in, and you're going to know that we care about you, we love you, and we want you to be safe, and your medications are going to be affordable. I mean, we've had powerful stories from patients this year with our pharmacy program as we've been growing it. But in Rathdrum, patients just coming in like wanting to give people hugs, and they go over to the clinic and they talk about what a great experience they've had in it. I mean, I think it's powerful. It's been great.
Well, and what a great opportunity to have the pharmacist there in the clinic with the provider and actually getting involved in the patient's care before medications are prescribed, making sure the patient gets the right meds and leaves that day with what they need.
That's that real partnership. I mean, I think that's what you're going to consistently see with the work that we do. We're not really not just that individual doctor that you're working with. Like, you're going to have a care team that's just there ready to take care of you. And it's medications, it's social support. I mean, it's all of these extra things that we do. And I think that's what community health centers just we do it so well. And that's a space where we get to take the time and just be there for our patients. So when we're talking about pharmacy, so we also added a really cool dispensing box into Post Falls. You want to talk about that for a second?
Yeah, so I this is particularly exciting and really addresses what we were hearing from our patients, that they wanted convenience to pick up their medications. So in Post Falls, we have this dispensing cabinet that we can fill their medications ahead of
Time, put them into this dispensing cabinet, and patients can pick it up when it's convenient for them. Huge benefit for our patients not having to travel farther distances to get their medications, and it's when they want to do it. I'm
Yeah.
super excited to see how we can do the similar things
No,
at the
Other
Center for
locations.
Health.
Yeah.
And also in like St. Mary's and Kellogg, we're talking about after this kind of pilot, we can also place it in some of our other
Right.
locations.
No, it's an exciting experience about how do you like the whole goal is just to make it easy for patients. And sort of on that vein, one of the big projects we've been trying to work on was we're working on this make it easy button for the organization. We want a patient to come in and just have it be easy. And so did a lot of work. Speaking of Post Falls, we really opened up a really amazing project around rapid care. Do you want to talk about that for a second? And
Yeah, so Rapid Care is again in response to what we're hearing from our patients that they wanted a convenient way to get immediate care, same day access to care. And so we had provider and staff in Post Falls who saw the vision and were excited to try something new. So we started what we've been calling Rapid Care. It's a great opportunity for our patients if they have an acute illness, they're sick, they need to see a provider. They can see the provider there and then get tied back into their regular provider when it's right.
we're really hoping to do something different than urgent care. Do you want to pick up on that piece?
Well, I think it's really an extension of their primary care visit without filling the schedules ahead of time. So, like keeping the schedule open, having easy access with online scheduling, which we all love to have the order ahead of time or and make it, really easy to get to it and not have to wait in line or schedule in advance. So leaving the schedules open and just having same day access. That's really the spirit behind it is not focusing so much on filling the schedule ahead of time and getting an appointment next week, but getting, coming in during certain hours and getting the care you need and getting on with your life.
Yeah.
And maybe you don't need to go to the ER,
Right.
but that's the
Yep.
Yeah, keeping
convenient
it
thing to
right.
do after hours. And now we have that option after
Yeah.
hours and our next steps to get to weekends.
Yeah, I mean, there's just so much fragmentation when you leave a system, and that's like I'm I am grateful for urgent care. It's a good tool, but when I look at primary care and the model itself, it's just like show up and we're going to take care of you. Like if you just have a fever and a cold and you're not feeling great, we're here for you. If you have some really complex conditions and you need a lot of time and attention, we're here for you. In the past, we've patients have called and our schedules are full, and we're like, we tell go, we're sorry, but we're full today, and we haven't had this resource to say, you know what, come in right now, and we're going to take care of you, or here's how we handle that. I think that is a really exciting thing, and that will be baked into the Center for Healthy Living.
Yeah.
Again, it's just consistent access across the board. If you need something, show up and we're going to take care of you.
And it really just actually keeps care in the right area. So it helps the ERs, it helps the urgent cares for the fracture that actually needs to go to an ER or an urgent care, higher level of care. It keeps care in the right areas so that we don't have, for our community, the wait times and things like that are at the right level of care.
Yeah, no, it's really cool to see it. We've done a lot of things this year, and it's just impossible to make a list and hit them all. But I think these have been some of the highlights. I want to. So our next episode, we're going to be talking with a couple of our board members, talking about sort of the strategy and vision behind the organization. But Alicia, I want to give you just a minute. Talk about like a big part of your job is helping us stay on track with strategy, but talk about some of the strategy elements that the board identified and that somewhat checked off the list this year, which is really exciting.
Yeah, well, so having a Center for Healthy Living is one of our big board goals, that we have a centralized place for care with all of our core services in Coeur d'Alene area. We're working with Post Falls and Coeur d'Alene going into that space. We've continued to like work on our stewardship with our cash flow and having cash on hand so that we're prepared for the future growth plans, and remaining like our goals to be a top employer of choice and an employer of choice, and also a patient provider of choice. So those are some of the board's key things to make sure we're doing. In the future, we're expanding into women's health. We're getting care to all of our extended communities that we're currently not all of our core services are in. So those are all of some of the key goals that our board has asked us to continue driving forward.
Well, it's been really exciting to see it. I mean, so I've been here about 15, starting 16 years now, and we've grown as an organization. But I feel like the last couple of years, our growth has been a lot more intentional, a lot more focused. I look at the work you did with getting Center for Healthy Living off the ground and running through the project lens. I think it's incredible. But I want to, as we wrap this up, I want to talk about why does this matter as a community member? So if you're watching this, well, yay, Heritage Health did some cool things. Like what this means is that if your kid is struggling with depression or mental health challenges, show up. We're going to take care of you. If you don't have access, you just moved into the community and you don't have a doctor, show up and we're going to take care of you. If you're looking for the best job of your life, show up and we're going to take care of you. And it's challenging. This is the hardest job I've ever had. And when I look at the people that work at Heritage Health, that is the secret sauce. Is we have the best people on the planet that are working here. Everybody cares. We have bad days, right? Like there's lots of days I know I go home and you guys are better than me, but I go home and I'm just like, oh, I'm just banging my head against the wall because it's so hard. There's so many challenges. But when I look back at what Lidwin, did at the start of this organization, I mean, it was just this never give up moment for us. And I think that's what continues. And I know I have days where like it would be nice to give up sometimes, but we know that we can't because when we do our things right, it saves lives. It makes life better for people. And we're so proud to be, a part of this community. As we close it up, is there anything you guys want to add as we say farewell to our amazing audience out there?
I would just say, like, we want to do it all. And that is the kind of spirit behind our strategic plan and continuing to plan going forward. We'd like to do everything. Everything is important for our community, like all of the things that we can do. But so, Heritage, we've spent a ton of time, especially in the last 15 months to 2 years, in really kind of putting a focus on what can we actually like. What are the things that are going to be most impactful for our community, and how do we continue to help serve our community? I think that's the difference. That's where we're shifting to be more intentional with. We can't do it all, so what can we do, and how can we make our biggest impact to support the community?
I just love coming to work every day. The people that work here have a true passion for what we do, and we want to make sure that we can provide the care that's needed when patients want it. And when there's a hard day or a big project we're working on, it's so fun to see everyone just dive in and just solve the problem and figure out how to do it. So it's really exciting.
Oh, I think it is so exciting. I look at 2026 and, the next few years ahead are just filled with opportunity for the organization. We've strengthened internal processes. We've gotten a lot better at different things. And I want to thank the two of you. I know you guys have put your heart and soul into everything that you do. And it makes a huge difference. And not everybody gets to see behind the curtains in everything that we do. And, it's really easy to sort of look at things and go, why did they do that? But I know, like, at the end of the day, everybody, we've got the heart for doing the work. And I'm so grateful that I get to work alongside you guys. So thank you for being here today. I hope everybody's enjoyed this episode. We're going to keep these rolling. This is such a fun project for us. We can't wait. We're going to be bringing guests in from the community to be interviewed. We're going to talk about building community, strengthening health inside North Idaho, and all of the crazy adventures that come with being a community health center in the most beautiful place in the country. So thanks for being here today. Have a great week, and we'll talk to you again soon.